Hi, I'm Dr. Sue,
Dr. Kardashian.
and we're here at Artlipo, liposuction and lipedema surgery. And one of the things that we do here that I'd like to talk about is something that's so special that almost no other doctors in the world do. I mean, they can count on a couple fingers, other doctors that do something similar, and that is celebrity arms. It's our coined term for doing a 360-degree sculpting of the upper arm in a high definition manner. It's not just going in and getting some of the fat. It's actually sculpting the fat so completely that you can see the nice natural contours of the bicep, the shoulders, the triceps. So it's just leaving a little bit of fat behind because we don't like to take everything. We want to take it down so that you see the most slimming and do it safely and that everything looks nice and smooth. And as a bonus, the way that we do it, we get a lot of skin retraction. So for most patients who are younger, in the 30s, even up to the 40s, that skin's gonna retract really well. And you're not gonna need any kind of skin excision or tucks, which unfortunately so many patients are told that they need, when they go to your typical surgeon. So that's the difference. We achieve a beautifully slimmed and toned and sculpted arm. And the reason, if I should, patients always ask, well, other doctors don't do this? No, I actually pioneered this because I was willing to take a step into an unknown realm. About 12 years ago, I did my first case. I was already treating most of the arm, but at one point a patient asked, can't you go all the way around? I said, well, I had quite a bit of experience, so I went ahead and did it, and it turned out great, but it's only gotten better as we've done more and more. And it's a no-go zone for other surgeons because they're all taught you can't. And when a whole generation or several generations of plastic surgeons go through the training, they're told you can't. You know what happens? They get trapped in the mindset saying, okay, well, I was taught I should never do this. And then they never try. Or they feel like they could get ostracized for doing it. But I took the risk and I did that about 12 years ago. It's turned out to be very safe. We don't have any real complications with it outside of what you normally see with liposuction. And when I say complications, I mean some bumpiness, but patients sometimes have bumpiness to begin with, or loose skin, which is there, and we always give you the good with the bad. We tell you, okay, if you're someone who's older in their 50s, I've done some 50-year-olds, I've done some 60-year-olds, but those patients are the ones that are gonna have a little bit of loose, crinkly skin. They're gonna have smaller arms, but some loose, crinkly skin, and some of them will need an arm lift on top of that. And all that we tell you, okay? So we're not gonna try to, we tell every patient individually what their expected outcome is gonna be. So very safe surgery, very great results, totally different from what any other doctors in this country are offering. So check us out, look at our results, go look at other doctors' results, and you'll see for yourself. Thank you.
Thank you.
Are you ready to have your celebrity arms?